Wow, I can't believe that we're halfway through day 2 already. We're a global team here at YourCoach, with team members in US and Western and Eastern Europe. We brought together experts from across the world to highlight the global reach that health and wellness coaches have while comparing and sharing best practices. Joining us from 2 continents are Izabella Natrins, Dominique Hodgin, and Kim Acedo, with Sarah Fisher moderating. Due to a time conflict, Fiona Cosgrove couldn't join us from Australia, but we have her insights to add to this worldly panel.
Okay, so welcome. It's nice to have a nice international representation in this particular panel for our Health Coaching Worldwide session. So I am pleased to have the following esteemed panelists with me today. I want to first introduce Dominique Hodgin, who's the Executive Director of Education at Dr. Sears Wellness Institute. Dominique, do you want to just give a few words about yourself?
Sure. So as you said, my name is Dominique Hodgin. I am located in the United States. I've been the Executive Director of Education for the Dr. Sears Wellness Institute for many years. I was actually brought on very early on in this organization to help spearhead some of the training. I am also a national board certified health and wellness coach through the CHWC, and I do sit on the advisory panel for them. And I've been integral in the health coaching industry for many, many years. So I'm excited to be here. Great.
Super. Thanks. Next, we'll move on to the UK. Izabella Natrins, who's the CEO of the UK Health Coaches Association. She's also the former Director of Professional Standards and Development. She's the founder of Izabella Natrins, Food, Health and Lifestyle, and she's the co-founder of the British Association for Holistic Medicine and Healthcare's Real Food Campaign UK. Izabella, what else can you tell us that I didn't cover?
Actually, nothing. Thank you very much for inviting us here. I'm really happy to be representing the UK. I guess the only thing that I could add to that is that we in the UK are very much champions of real food and food first for health coaches and helping our health coaches understand just to get their clients off the processed food and onto real food and whole foods is something that we're all very committed to, which is why I wear the double hat, really. Yeah.
Great, fantastic. And Kim Acedo, did I say it correct, Kim?
That's right.
Joining us from Canada. She's a virtual health and self-care coach for women in midlife from Vancouver. Kim, turn it over to you for a couple of minutes.
Yeah, so I've always had my own private practice as a health and wellness coach for women in midlife. So I'm very niched in my audience. I moved to Canada almost 3 years ago from Los Angeles. So most of my training and education has been there. I'm the membership director for ICF Vancouver chapter. And I have a master's degree in health science, and I'm a certified health and wellness coach.
Super. Great. Ladies, let's jump right into the discussion because I think that's what everybody wants to hear. I wanted to start with a question around what trends you're seeing in the coaching industry in your respective geographies. So what's been emerging over the past years? And maybe it's interesting also to touch on a little bit of what you're seeing in the coaching training versus nutrition training and how those worlds are meeting. But I'll turn it over. Maybe I'll hand the floor to Dominique. Why don't you get us started?
Sure. Well, here in the US, health coaching is definitely on the rise. The industry in total has probably been around for about 10 years. But in the last 5, since the National Board for Health and Wellness Coaching has come on the scene, it has grown tremendously. And we're seeing health coaches become an integral part of the healthcare teams here in the US. And it's been exciting to see, even with our current worldwide state with a pandemic, health coaching is growing even more because people are becoming more aware of their own health and realizing how important food and movement are in their own healthcare. And so the trends are amazing. I've never seen anything like it since in the last 5 years. It's growing.
That's great. I mean, does anyone see, are you seeing similar in the UK?
Oh, absolutely. Yes. I mean, we're very fortunate in that actually just since, I think it was mid-September, our NHS National Health Service has embraced health coaching within the NHS and has set up something called the Personalised Care Institute to help integrate health coaching and other modalities that are aligned to personalised care, to bring it into the NHS in a very big way. So we're very, very pleased that they are seeing the light and the value and the benefit of having that health coach within each of the primary care practices. And I guess really for us, we're seeing, probably the same for you, we're seeing a huge explosion in, health apps and health tech, and lots of behavioural change gizmos, which are absolutely fantastic. But we feel very strongly that these should be aligned with the human input from an experienced and well-qualified health coach, and how powerful those, the interface of technology and humanity can be in helping people change their behaviour. Yeah.
That's super. Kim, and you've done this across 2 geographies now, I think, right? So.
Yeah. So it's been interesting to kind of see the difference. In Canada, I think coaching in general is a little more well-known. There's a lot of team coaching, executive coaching. So people sort of understand a little bit more, I think, what coaching is. As far as wellness coaching, I feel like it's more specific here in Canada. Like you go and you get a nutrition certification, or you go and you get a, very specific certification. Whereas I felt like in the US, it was just a little more broad, which was my own experience. Something that's interesting about Canada is that there's a big emphasis on diversity and inclusion. So seeing health from different perspectives, and hearing about people's health who are dealing with different, societal issues, environments, economics. Those things are really important to people here in Canada. Prevention, health promotion, getting in front of disease and illness as opposed to trying to fix it afterwards. So those are some of the things that I'm seeing here in Canada.
Yeah, I mean, and that kind of actually leads into the next area where I was going to go into. I mean, a lot of you are talking about the different certifications, right? Kim, you were just mentioning some. And actually one of the panelists who wasn't able to join us from Australia due to the time change, Fiona Cosgrove, who's the owner and founder of Wellness Coaching Australia, she also, I think, now has a board certification program. So like one of the first international programs with a board certification. So let's talk about kind of that accreditation, other types of services that you're seeing from the health coaching community. What's front and center in your geographies and your communities? What kinds of accreditations are sort of leading the way that people say, okay, it's nice that you've got this foundational education, but, Dominique, as you mentioned, in order to work in more of the healthcare setting, what sorts of accreditations are really required? And is board certification a differentiator or just a nice to have?
Yeah, I think that for sure it is. Right now, it's nice to have. I think that the trend is definitely going more towards that area. That board exam, the first board exam that was offered here in the US was done in 2017, September of 2017. It's a rigorous exam. It's 4.5 hours long. It's an intense exam. And I think that the fact that the NBHWC has to approve programs for specific programs to have their graduates qualify for the national board exam is the first step in that process. There is an amazing amount of work that goes into prepping for that board. And so it's very well recognized. And as that has come to the forefront, more and more organizations are seeing that as a qualification to hire coaches. And so the trend is definitely there with the National Board for Health and Wellness Coaching. And even though it's a U.S. programming, the exam is actually offered internationally. So there's exams offered all over the world through the organization that they've partnered with to offer that exam. So I'm not sure how recognized. I'd be curious to hear from our other panelists here if that's recognized in their areas as well.
Yeah.
Okay, sorry.
No, I said jump right in, Izabella.
Alrighty. So I'd like to say yes, it is very much recognised. Clearly, it's not a requirement here in the UK, as it I'm sure will be ultimately, in the US. But we have an increasing number of members within the UK Health Coaches Association. So we're for the UK and Ireland. We have an increasing number of members that have graduated from schools that are recognised by the National Board. And we're very pleased to say that we have taken your framework in America to actually embed when I came into post as Professional Standards Director, we quickly recognised that we wanted to future-proof our standards and, help our coaches really get integrated into what was coming as we saw it in the health systems in the UK and Ireland. So we have taken the framework that the National Board has worked so very many years and so hard to put in place, and we've used that as the foundation for our standards, which we are currently revising and updating as we speak. We're very pleased to be doing that, because it's an amazing piece of work, and I can only congratulate you guys for the National Board website, the support that you give to your students, to the schools, for the school's approval process. It's all really, really high quality, and big congratulations. And we're learning a lot from you here in the UK.
Yeah, and I have to agree, because coaching is not regulated, we need to have these standards, right? So that we're able to raise the profile of coaching as a profession. And I'm hearing some of these things for the first time, as far as, having to, prepare for the exam before you graduate or things like that. So I really like where this is headed. As far as where Canada is with that, I'm not quite sure. There are a couple of wellness coaching schools here, but they're in Ontario, so they're on the other side of the country. So I'm not quite sure about that, but yeah, definitely the US has led the way as far as the National Board certified credential. Yeah.
Super. And that kind of triggers in my traditional healthcare brain a question around reimbursement. So where are you finding that many of the health coaches are finding their work in your networks locally in each of your geographies? Is it possible to bill for any kind of reimbursed payment by an insurance companies, or is it really still private pay, personal pay, primarily driven in those aspects? What kinds of trends are you seeing with that respect, and how difficult is the reimbursement landscape for health coaches? I'll turn that to anyone who wants to jump in this time.
If I could start, because it's very different in the UK, obviously, because we have a National Health Service. So those patients who actually are referred into the health coaching discipline within primary healthcare at the moment, that's where they've bedded it in. Those, we have our health services free at the point of delivery still. However, many of our members don't work within the NHS. That they've just opened their doors, as I say, since September. But many of ours work in private practice, and increasingly in multi and interdisciplinary practices in private healthcare. So that is pay as you go. And, increasingly it's either loose referrals through informal networks, or a much bigger number now of practitioners outside the NHS with some frustration because they want to either practice functional or lifestyle medicine, which is still very new for the NHS. So these guys are, getting together and creating, what I'm sure will be a very high quality, important and, alternative for people to come to, in the fullness of time. So we're very, very excited about the whole thing, really. It's a pleasure to see it in the UK.
Great. Kim, Dominique.
Well, just with the single payer healthcare system in Canada, there's a lot of emphasis around already, the prevention, like I talked about earlier. So as far as health coaching, that's kind of an added service. But if you work for a pretty good company here, there are definitely a lot of benefits around health coaching that you can get externally. But access to healthcare, is really it's something that everybody has. So that's really nice. And then additionally, things, are on top of that you can pay for, or a lot of it is paid through your employer. As far as wellness coaching, that could be through your employer, perhaps 100% paid, if not 80% to 100% would be paid by your employer, which is really great.
Oh, that's great. Yeah.
Well, here in the U.S., clearly, we're not on a one-pay system. We do still have insurance companies, and so this has been an interesting progression with the national board. So back in January of 2020, the American Medical Association did issue 3 CPT billing codes for insurance. They're what they're called a category 3, which means there's no guarantee that the patient would be or that they would be able to get paid. The health coach could be paid by the insurance. But there's a process that it goes through. It's up to a 5-year process that as more and more physicians are billing insurance for the health coaching, and you do have to be board certified to be qualified to bill insurance. But what the trend and what we're hoping to see is that we get to what they call a category 1, which means it's more likely that insurance companies will pay. We're also seeing HSA accounts, health savings accounts is what that stands for. And what's happening is that a lot of organizations are allowing those monies to be used towards health coaching. We obviously still have self-pay, so that's still an option too. So it really just depends, but there's a lot of companies that are hiring health coaches, and one company coming to my mind right now, they actually find health coaches for insurance companies. So insurance companies here are starting to see, just like in Canada and probably in the UK, they're seeing the benefit of bringing a health coach on early on to help with prevention, right? To treat disease states early on in the process, to stop them from progressing and not allowing those disease states to get out of control where there's a treatment, it has to be a treatment plan. But that is something that is definitely on the trending here in the US. And that's a big shift for us and something very exciting to be seeing.
Yeah, that's a great, yeah. So yeah, and in every respect, it sounds like things are, there's a lot of momentum behind the value and the contribution coming into healthcare from the health coaches. So it's not just kind of if you're looking for some external, coaching via your own private pay situation. I mean, obviously, as we discussed, there are a lot of different ways that these things they can be reimbursed or compensated for, whether by employers, self-pay, or as an add-on to actual, free practice of healthcare. So that's all great trends. And I'd love to hear a little bit more about outside of this panel, how are you finding ways to connect with health coaching associations internationally to be able to share these insights and these learnings, or is everything really primarily at the moment focused domestically for you ladies?
Well, I guess if you mean associations, there are not that many. They're just beginning, I think, to create themselves. But we're very proud that the UK Health Coaching Association is for the UK and Ireland is the first in the world, actually. And now we have our colleagues in Australia and New Zealand who have recently formed, and who actually I was just on a call this morning with Fiona, who can't be here because of the time, issues. But the GWI coaching initiative has a panel from Australia, New Zealand, the USA and Singapore, and of course ourselves. And we're very excited to be bringing all of those constituencies together all around the world to kind of get onto the same page and align ourselves so that we're actually supporting each other and speaking with the same voice. So we're very much in tune with that. And our own in the UK, we have, as I say, an increasing number of graduates from UK schools, and we're very pleased to welcome them. And as well, we've recently approved a school in New Zealand for the first time. And we have an increasing number of UK-based schools that are working with universities and colleges of higher education to produce some really first-class training courses. So it's an exciting world.
So yes, Izabella, yes. Great. And how about from North America, for both Dominique and Kim? How is is there actually even coordination between Canada and the US on some of these topics? Not really. No.
Yeah, there should be. I mean, and just to echo, I think that we do need to get on page internationally, and we, having everybody kind of be on that same platform and that same premise as far as putting health coaching first and foremost to help prevention, right? And to focus on more of that functional medicine, lifestyle medicine, the prevention side of things. There's tremendous data and research out there that shows it works. We've probably all seen that. And it's just a matter of getting the more traditional side of things across that chasm and into the prevention realm so that we can all be a part of that process.
That's right.
Right. Yeah, there's just a lot. Yeah. Like Dominique said, there's a lot of research, just that the fact that, illness is very expensive, but prevention is much cheaper. So I think people are starting to understand this. It benefits everybody economically, health-wise, as we're seeing with COVID. There's a lot of talk about let's reopen things, let's get things going so we can get the economy open again. But if we understand, this is a prime example of wellness here and health here, is that the best way to, build the economy is to get healthy, right? So I think this is really, shined a light on the whole world's health, right? And you're looking at the countries that are doing really well, and there's not a lot of obesity in those countries. Those are countries where there's good healthcare. There's community, so people are thinking about each other, because we know that affects our health as well when it's not such an individualistic mindset. So yeah, I'm hoping that COVID really helps us all get on the same page as far as, look, this is good for everybody. When we're healthy, everybody does better. So it's exciting to think about.
And let's sort of bridge that passion into maybe talking about the passion you all had about getting into this space. So if you could think of maybe a story from your experience in coaching so far, or something that inspired you to actually get into the industry itself, right? To start to say, hey, why are each of you kind of leading the way in your respective geographies and carrying the flag, for the health coach community? I'd love to hear, stories you've had with clients or your own kind of personal experience about why you're passionate about the space. Anyone can go first. Izabella, I'm going to call on you.
All right. I got into this. I've been in the health space for many a long year, but I got into health coaching really through my own autoimmune condition, which, and as I ran away from my rheumatologist with being chased by a prescription for methotrexate, I thought, I don't want to go there. So as a former health researcher, health psychologist in research, I started to research into my own health and soon found that, my goodness, how many ways could I actually get healthy here? So fired with that, I started to create a prescription for my own, a lifestyle prescription for my own health, and then quickly saw that this was something I really wanted to do. So I trained. And my best successes with clients have been other women with autoimmune conditions. I had psoriatic arthritis, which I've put to bed, and I've helped several actually women with this and endometriosis of all things. And I mean, it's astonishing how much progress you can make if as an individual you're committed to finding better health, to creating that resilient health, and to doing it holistically. So, you know, looking at why you want your health in the first place and working from that sense of individual purpose and meaning, and then making all the small steps around the whole of the, you know, the pillars of health. So that's why I got into it myself. That's the way I found, and it's definitely the way I practice. And I'm thrilled as on a practitioner level to be able to support people to get kind of results that I'm only doing what I do now, actually, because I managed to get myself back into a place of health instead of illness.
It's a great story. And it's one I think we see quite often, honestly, that it starts with yourself and then you realize what's possible and you want to share it with others. So I can imagine maybe there's a similar theme as we keep going around this virtual panel.
Actually, I mean, that's the whole, I mean, obviously I'm the director of education for the Dr. Sears Wellness Institute, and Dr. Sears, his story really impacted me. I actually have lost 2 immediate family members to obesity-related illnesses. Obesity starts a whole train of reaction with things. And so I had a personal interest in this industry, and then meeting Dr. Sears and hearing his story. He's a stage 4 colon cancer survivor. 25 years ago, his diagnosis was pretty grim, and his prognosis was pretty grim. And he decided at that point to we have these principles that are kind of the foundation of what we teach, and it's lifestyle, exercise, attitude, nutrition, and they all 4 work together. They're the 4 pillars of health. And he, as a physician and as a researcher, he worked actually for the National Institutes of Health for many years. And so just an avid researcher, and started looking, and this was many years ago, right? 25 years ago, started looking into how do I survive this, and realized that those 4 key factors were missing out of his life. And as a doctor, many doctors are not very healthy for some reason. They tend to take their own advice. And so he was very typical, and he got into just understanding and learning about these 4 areas and started implementing them in his life, and started seeing the dramatic recovery that was happening. And his physicians were baffled. Well, why is he recovering so quickly? How is he recovering from this? He still had traditional treatment plans, of course, but overall, his, surviving at that stage of cancer that far advanced is tremendous. And my background previous to coming into this world was in the pharmaceutical industry. So I spent many, many days in cath labs and hospitals and teaching hospitals and working with physicians and seeing what happens when you don't take care of yourself. So it's a personal thing for me, seeing all these medications that are out there, which are necessary in some cases, of course, but how many things can be prevented before you get to that stage. And so for me, it's a personal journey, just from all of the things that I've had the privilege of learning, and then knowing Dr. Sears and knowing his story, and then seeing it has an impact on my own family by not taking care of yourself, and what can be the end result of that. So it's a passion for me.
Great.
And for me, I just took the things that I love. I love business. I love the stage of midlife in a person's life. I love women's equality, and I want to further women's health and equality and longevity and health. So I basically took all those things together and created my own virtual coaching practice. I wanted to have location freedom, so I decided to go virtual, which was which has been fine for me, right? Because I didn't really lose any clients because I was already virtual. So that was nice. And then, just being able to choose who I work with every day, which is why I chose to go that way, as opposed to working for a company that would feed me clients. I wouldn't have to go and get the clients, but I wouldn't be able to choose who I work with. So, so I was able to to choose my demographic, and really helping women realize, because I'm sure all of us here have been on many, many diets throughout our lives, but helping women realize that it's not just about diet and exercise, but it's about sleep, it's about stress, it's about our relationships, it's about our environment. There's so many different factors that go into our health and well-being and our happiness, and they're all connected. And I think globally, we're just starting to see that. That it's well beyond dieting, but it's about the stories we tell ourselves, and the things that we need to unlearn, having to do with our weight and the scale, and you name it. I'm preaching to the crowd here. So yeah, that was why I got into the work that I do.
Well, and you hit on two other key points that, I'd love to hear what you all are seeing with these two these two different lenses. The first being that this invisible woman concept, that most of the data, for years or for decades, even better described, has just really not been focused on women in general across the board. And then especially when you look at female health, right? So like these kind of reproductive mysteries, like how could that possibly still be such a mystery? Some of the fertility issues that women have dealt with, or you mentioned endometriosis and things that just become very underdiagnosed in women. So there's that lens. I'd love to hear of, do you find that most of your practice is really focusing on the gaps that healthcare leaves behind for women? And is it still true today? Are you seeing any trends where people are proactively coming for some health coaching and support to get educated before they have a catalytic health crisis? Or are most people coming to you still with a chronic ailment or condition, similar to what you'd say, you'd show up at a physician's office only when a symptom arises? Are you seeing people that are just taking a genuine interest in their health, or is pretty much all of what you're seeing still very symptomatic and sort of responsive? I'd love to, with those two angles, I'd just love to hear about what you all are seeing in your practice.
Well, shall I go first then?
Sure.
Well, yeah, for me, I think that menopause and the midlife area is very, that I see so many women coming now. In the UK, we have traditionally been not very well served for women at midlife, and finding them coming earlier into perimenopause, as I'm sure Kim would see too. That the health problems, in my practice, I see women in their late 30s already coming with symptoms and worry, not dreadful ones, some are, but not dreadful, but they're now are aware enough to feel that they want to know more. So some do come for preventive. What can I do? How can I stop this from getting worse? Can we nip it in the bud? Others are coming because they are desperate not to have surgery or yet another hormone regime that hasn't worked before. And actually then on the other end of the scale, the top end of my age range particularly is in the kind of going into their mid-50s. And I'm finding that these are women who want a good old age. They want to get, put, the life into their years rather than the years, into their life. And they want vibrancy, and they want to eat right, and they want to, what are the things? I want to do the things because I want to enjoy my life. So it's great to welcome those women. And I'm so pleased, really. There's, for me, we women hold the world in the palm of our hands. We're hardwired to care. We're hardwired to be the healers. Traditionally, the female has been the healer. And I'm very much, I'm sure Kim would agree, on a mission to say to women, reclaim that power, because it's so powerful and so needed in the world today.
Well, if that's not inspiring, I don't know, Dominique, Kim, can you add? Any other
It's-
thoughts, guys? Are you
yeah,
seeing?
just that it's great to hear people from around the globe. I mean, I wish we had the other lady that was going to be here. But yeah, it's really great to come together and talk about these issues and see that we're all on the same page and we all are, we want the same things for each other. And, because I have my own practice, it's out of pocket. So, so there's a very high motivation to make some changes when somebody comes and works with me because they have to pay 100% of that. But I'm also seeing a younger demographic starting to work with me. People often ask, what is midlife, Kim? What do you say midlife is? And I used to call it an age, but now I see it more of a stage in life. And, there are many women who are single, never been married, or never had kids, or had kids late or whatever. So we're seeing, that this is really changing based on our world and what's happening with women. So yeah, I'm seeing a younger demographic starting to work with me, which is a good thing. They're nipping those things in the bud, like someone said earlier. Yeah, so.
Well, I'll address the second part of your question since we've kind of covered the female, although I do find it very interesting that health coaching is very female dominated. I don't know if you all have that in your countries too. Very female dominated, not only people who want to be health coaches, but our clients are very female dominated. But in general, as far as like who's seeking health coaching, definitely there's people out there who are a little bit on the forefront of things saying, yes, I want to prevent things. I want to grow old well. I want to age well. I want to enjoy my life for a much longer period of time. But there's also this, especially in the US, where our food sources is probably worse than both of your other countries. We have an incredible amount of processed food where there's people that don't even know they're not healthy because they've never been healthy. They don't even know what that feels like. And so sometimes it's crossing that barrier where we're helping to educate people on what does it mean to be healthy? What does that look like? It's not rocket science where a lot of people think, oh, it's so hard to be healthy. It's eating healthy and moving your body. It's not difficult. And helping coaches, empowering people to understand really the simplicity of it. And then just being there as an accountability partner to help them progress through that process and that change process and making those things happen. But it really truly is a matter of educating our populations to help them understand that there is another way to feel. You can feel better. You can have more energy. You can sleep better. You can hurt less. All of these things that people don't even associate sometimes with how we eat and how we move, right? And so that's been an interesting progression. And America's still way behind the curve on this. We're still very much into where people think that, oh, food and movement don't affect how I feel. And so we're on a big educational process here, trying to help people get educated in what that looks like for them.
Yeah. And that must be I can imagine how surprising that is when you run into it. I mean, when there's a saying, find your tribe. And I'd say everyone in this little virtual room is in there. We're in the same tribe, right? We're all singing from the same sheet of music. And when you run into someone that has no concept of the fact that your food can impact your health, it always hits me like a ton of bricks. Like, what? You didn't know that? Like, how could that not be so clear? But yeah, that always gives value to the work that you all are doing. I realize that we're coming to the end of our session, so I will leave with one last question for you all, and that is your goals for 2021. If you name one, thing you aspire to achieve as we head into 2021, what would that be for yourself and for the profession?
Ooh. Well, I guess I would like to just finish or progress the job I've started, which, for myself is to really step up to the plate of being the CEO of the UK Health Coaches Association. As I say, I'm very proud. I think we can move mountains. We've got a fantastic team in place now. We've had a lot of change within the teams, and we have people in place now that we know are going to take us forward. And for the profession, to continue to create and maintain robust, high standards for training, for education, to continue scope of practice, and making sure that our coaches know what they are meant to do and, you know, what's out of scope, and to contribute to the international stage, really, to, you know, to take the whole thing forward with you all, really. Yeah.
Fantastic. Kim, Dominique?
So for the profession, I would say is to be able to continue to place more emphasis, especially as we're here in COVID, right in the thick of it, on sleep and stress. I don't think we place enough emphasis on the importance of both of those things and as they factor into our health and well-being. And then personally in my coaching practice, I have a podcast called the Me Time Midlife Podcast. It was number 17 in midlife podcasts 2 years ago. It was number 7 this year. So I really like to see that move up this coming year in 2021 to just have more awareness for women's issues in the midlife stage.
Fantastic. And Dominique?
Personally, you know, I'm very involved with development and creating new trainings and new concepts, and just to continue that work in 2021, just to really understand what people need. And, you know, Kim, I really think you touched on it. Stress is a huge factor right now, and how that impacts our health, and how to make that more relevant for people to understand that idea. Professionally, I think that I would love to see that chasm close between traditional medicine and holistic health, right? That just closing that gap, helping educate more physicians, more healthcare providers to bring health coaches, even though they are definitely starting to become part of that integral healthcare team, is to make that more prominent, to really help educate the medical community. And, you know, we have the privilege of doing that here at the Sears Wellness Institute, just because we have a doctor that developed the program. But there's still a big chasm, and we need to close that gap to help really transition health coaching and the industry, the ideals, really into traditional medicine. I'd love to see that happen in 2021.
Super. Ladies, thank you for an inspiring session and for allowing me to facilitate it. I hope it's not our last global gathering, and that we get to chat again sometime in the future. But I really enjoyed it. So thanks so much.
Thank you.
Thank you.